Did you know that the liver is one of the most crucial organs in your body, playing a key role in filtering toxins and aiding in digestion? However, it's also one of the organs most vulnerable to damage, sometimes from unexpected sources. The liver is your body's largest internal organ and a powerhouse of metabolism, detoxification, and nutrient storage. It filters blood from the digestive tract, detoxifies chemicals, metabolizes drugs, and produces essential proteins for blood clotting. This makes liver health not just important, but absolutely essential for overall well-being. But how do you know if your liver is in trouble? Some common signs of liver distress include jaundice, a yellowing of the skin and eyes, abdominal pain and swelling, chronic fatigue, nausea or vomiting, and unusual changes in stool or urine color. Interestingly, the very medications we take to improve our health can sometimes have adverse effects on our liver. This is because all medications are processed in the liver. Some drugs can lead to liver toxicity, which means they can damage liver cells, leading to inflammation, and in severe cases, even liver failure. Understanding which medications can have these harmful effects is a key step in protecting this vital organ. In this video, we'll explore 10 common medications that may pose risks to your liver, and the symptoms that indicate your liver could be under stress. Stay tuned to learn more about these medications and how to recognize the warning signs of liver problems. Let's start our countdown with 1. Acetaminophen, Tylenol. Let's start with a medication that's commonly found in many households, acetaminophen, known widely by its brand name, Tylenol. Acetaminophen is a popular over-the-counter pain reliever and fever reducer, but it also has a darker side when it comes to liver health. Acetaminophen is metabolized by the liver. When taken in recommended doses, it's generally safe and effective. However, the trouble begins when it is taken in high doses or over an extended period. According to a study published in the Journal of Clinical Pharmacology in 2020, high doses of acetaminophen can lead to a condition known as hepatotoxicity, essentially, liver toxicity. This happens because the excessive amount of acetaminophen overwhelms the liver's ability to process it safely. In severe cases, this toxicity can lead to acute liver failure, a life-threatening condition. It's particularly risky when combined with alcohol or other drugs that also impact the liver. The study highlights that liver injury from acetaminophen overdose is the leading cause of acute liver failure in the Western world. It's crucial, therefore, to adhere strictly to the dosage guidelines when using acetaminophen and to be mindful of its presence in many combination medications, like cold and flu remedies, to avoid accidental overdose. Next, number 2, non-steroidal anti-inflammatory drugs, NSAIDs. Moving on to another group of commonly used medications, non-steroidal anti-inflammatory drugs, better known as NSAIDs. This category includes well-known drugs like ibuprofen and naproxen, which many of us use regularly to relieve pain, inflammation, and fever. Despite their widespread use, NSAIDs carry a risk to liver health, especially when misused or overused. A study published in the American Journal of Medicine in 2021 delved into the impact of NSAIDs on liver health. It found that while NSAIDs are generally safe for the liver when used as directed, cases of liver injury have been reported, particularly with prolonged use or high doses. The liver damage can range from mild enzyme elevations to severe liver failure. The risk is compounded when these drugs are combined with other medications that affect the liver, or in individuals with pre-existing liver conditions. It's important to note that liver damage from NSAIDs is relatively rare, but it's a serious concern that should not be overlooked. The study emphasizes the importance of following dosage instructions and seeking medical advice for pain management, especially for those with underlying health conditions or those taking multiple medications. As with any medication, moderation and adherence to guidelines are key to minimizing risks and safeguarding your liver's health. Next, number 3, Amiodarone, Cortisone. Now, let's talk about a medication used for a very specific purpose, Amiodarone, also known by its brand name Cortisone. This drug is prescribed for managing and treating certain types of serious heart rhythm problems, particularly in cases where other medications haven't been effective. While Amiodarone is an important medication for those with specific heart conditions, its impact on the liver is a significant concern. The Journal of the American College of Cardiology highlighted in a 2022 publication that Amiodarone has been linked to several forms of liver injury. These range from mild liver enzyme elevations, which are relatively common, to more severe forms of liver damage, including hepatitis and cirrhosis. The risk of liver toxicity increases with higher doses and prolonged use of Amiodarone. It's important for patients on Amiodarone to have regular liver function tests to monitor for any signs of liver injury. The study also points out that patients with pre-existing liver conditions need to be particularly cautious when using this medication. This example underscores the critical balance in medication management, the need to treat one condition effectively while being mindful of potential side effects on other parts of the body, like the liver. Next, number 4, Methotrexate. Next on our list is Methotrexate, a medication that serves a dual purpose as both a chemotherapy agent and an immune system suppressant. It's commonly used in the treatment of certain cancers and autoimmune diseases like rheumatoid arthritis and psoriasis. While methotrexate is effective in treating these conditions, its impact on liver health is a significant concern, especially when used long-term or in high doses. A study published in the New England Journal of Medicine in 2023 highlighted the risks associated with methotrexate in relation to liver health. The study found that prolonged use of high doses of methotrexate can lead to liver fibrosis and cirrhosis, a serious and irreversible condition. Patients on methotrexate often require regular liver function tests to monitor for signs of liver damage. The risk is also higher in patients with pre-existing liver conditions, those who consume alcohol regularly, or those who are obese. The study recommends careful monitoring and possibly adjusting the dosage for patients at risk of liver damage. This information is crucial for individuals undergoing treatment with methotrexate, emphasizing the need for regular medical supervision and adherence to prescribed dosages to minimize the risk to liver health. Next, number 5, statins. Let's turn our attention to a group of drugs widely prescribed for lowering cholesterol levels, statins. Commonly known brand names include Lipitor, Crestor, and Zocor. Statins are a cornerstone in the treatment of high cholesterol, particularly in patients with a risk of heart disease. However, there's a lesser-known aspect of statins that's important to consider: their potential impact on liver health. In rare cases, statins can lead to liver inflammation. According to a study published in the Journal of Hepatology in 2022, while statins are generally safe for the liver, there have been instances where patients have experienced elevated liver enzymes, an indicator of liver inflammation or damage. The study emphasizes that the risk of serious liver damage from statins is extremely low, and in many cases, the benefits of lowering cholesterol significantly outweigh these risks. It's also noted that liver function typically returns to normal after discontinuing the drug or lowering the dose. Regular monitoring of liver enzymes is recommended for patients on statins, especially during the initial stages of treatment. For those prescribed statins, it's essential to have a conversation with your healthcare provider about the balance of benefits and risks, including the potential effects on liver health. And before we delve deeper into our next medication, a quick note: if you've been finding this video insightful, do consider subscribing. This small act tells us we're connecting with you, crafting content that informs and resonates. Now, let's get back with medication number 5, Isoniazid. Another important medication to discuss is Isoniazid, an antibiotic that's primarily used in the treatment of tuberculosis, TB. While it plays a crucial role in controlling this serious bacterial infection, Isoniazid is also known for its potential side effects on the liver. A significant study published in the Lancet Respiratory Medicine journal in 2023 highlighted the liver-related risks associated with Isoniazid. The study found that in some cases, Isoniazid can lead to liver toxicity, a condition where the liver is damaged by chemicals. This toxicity can range from mild to severe and is more likely to occur in certain high-risk groups, including older patients, those with pre-existing liver disease, and individuals who consume alcohol regularly. The symptoms of liver toxicity due to Isoniazid can include fatigue, nausea, loss of appetite, and yellowing of the skin or eyes, jaundice. The study underlines the importance of monitoring liver function tests in patients treated with Isoniazid, especially those at higher risk of liver damage. For those undergoing treatment for TB, it's essential to understand the potential risks and to maintain regular communication with healthcare providers to manage and mitigate these risks effectively. Next, number 7, Tamoxifen. Now, let's discuss Tamoxifen, a medication primarily used in the treatment of breast cancer. Tamoxifen has been a breakthrough in managing hormone receptor-positive breast cancer, but it also has potential side effects that impact the liver. A comprehensive study published in the Journal of Clinical Oncology in 2023 sheds light on the liver-related complications associated with Tamoxifen. The study reports that while Tamoxifen is an effective treatment, it can lead to various liver problems, including fatty liver, hepatitis, and in rare cases, cirrhosis. Fatty liver is a condition where fat builds up in the liver cells, hepatitis refers to liver inflammation, and cirrhosis involves the scarring of the liver, which can impair its function. The risk of developing these liver issues varies among individuals and can be influenced by factors such as the duration of tamoxifen therapy, the dose, and the presence of other liver risk factors like obesity, alcohol use, or pre-existing liver conditions. The study emphasizes the need for regular liver function monitoring in patients taking tamoxifen, especially those with additional risk factors for liver disease. For patients undergoing breast cancer treatment with tamoxifen, it's crucial to be aware of these potential side effects and to have regular checkups with healthcare providers to monitor liver health and address any concerns promptly. Next, number 8, Methotrexate. Methotrexate is a medication widely used in the treatment of various chronic conditions, notably rheumatoid arthritis and psoriasis. It works by suppressing the immune system to control inflammation and slow down the progression of these diseases. However, its impact on liver health is a significant concern, especially when used over the long term. A detailed study published in the Annals of Rheumatic Diseases in 2023 explored the effects of methotrexate on liver health. The study found that long-term use of methotrexate, particularly at higher doses, can lead to liver damage. This damage may manifest as elevated liver enzymes, a sign of liver stress, and can potentially progress to more serious conditions such as fibrosis or cirrhosis of the liver. Fibrosis refers to the development of excessive fibrous connective tissue in the liver, while cirrhosis involves the formation of scar tissue, which can significantly impair liver function. The risk of liver damage is higher in certain populations, including those with pre-existing liver disease, individuals who consume alcohol, and patients with obesity or diabetes. Due to these risks, regular monitoring of liver function is crucial for patients on methotrexate. This involves routine blood tests to check liver enzyme levels and, in some cases, may include liver biopsies to assess the extent of liver damage. For those taking methotrexate, it's vital to maintain an open line of communication with your healthcare provider, adhere to prescribed dosages, and undergo regular liver health assessments to minimize the risk of liver damage. Next, number 9, certain antifungal medications. Another category of medications that warrants attention for its potential impact on liver health is certain antifungal drugs, particularly ketoconazole and fluconazole. These medications are commonly used to treat a variety of fungal infections, ranging from superficial skin infections to more serious systemic conditions. The concern with these antifungal agents, especially when used extensively or in high doses, is their potential to cause liver damage. A study highlighted in the Journal of Antimicrobial Chemotherapy in 2023 specifically addressed the hepatotoxic effects of drugs like ketoconazole and fluconazole. It was found that these medications can lead to a range of liver abnormalities, from mild elevations in liver enzymes, which are usually temporary and resolve after discontinuation of the drug, to more severe forms of liver injury, including acute hepatitis and, in very rare cases, acute liver failure. The risk is particularly notable in patients who require long-term or high-dose antifungal therapy and those with pre-existing liver conditions. This makes regular liver function monitoring a key aspect of the treatment plan for patients receiving these antifungal medications. The study advises healthcare providers to weigh the benefits of antifungal treatment against the risk of liver toxicity and to consider alternative therapies or dosage adjustments where necessary. For individuals prescribed these antifungal medications, it's important to be aware of the potential liver-related side effects and to communicate any concerns or symptoms to your healthcare provider promptly. Next, number 10, certain antiretroviral drugs. In our discussion of medications that can impact liver health, it's crucial to mention certain antiretroviral drugs used in the treatment of HIV/AIDS. Antiretrovirals are the cornerstone of HIV treatment, effectively controlling the virus and enabling patients to lead longer, healthier lives. However, some of these medications come with a risk of hepatotoxicity, or liver toxicity. A significant body of research, including a study published in the AIDS Journal in 2023, has examined the hepatotoxic effects of certain antiretroviral drugs. This study found that while most antiretrovirals are safe for the liver, a few can cause liver problems, particularly in certain groups of patients. These issues can range from mild increases in liver enzymes, indicating minor liver stress, to more serious conditions like acute hepatitis, which can be life-threatening if not managed promptly. The risk of hepatotoxicity is higher in individuals with pre-existing liver diseases, such as hepatitis B or C co-infections, and in those who consume alcohol excessively. The study emphasizes the importance of regular liver function monitoring in patients receiving antiretroviral therapy, especially those at higher risk for liver complications. For patients undergoing HIV treatment, understanding these risks is crucial. It's important to have regular checkups, adhere to treatment regimens, and maintain open communication with healthcare providers about any concerns or symptoms related to liver health. How to protect your liver. Maintaining the health of your liver is crucial, especially when you are on medication. Let's discuss some effective strategies to protect your liver and ensure its optimal functioning. 1. Understand your medications. Be aware of the medications you're taking and their potential effects on your liver. This includes prescription drugs, over-the-counter medications, and supplements. Always follow the prescribed dosage and never exceed it. If in doubt, consult your healthcare provider. 2. Regular monitoring. If you're on long-term medication, especially those known to affect the liver, get regular liver function tests as recommended by your doctor. Keep an eye out for any signs of liver distress, such as jaundice, dark urine, fatigue, or abdominal pain, and report these to your doctor immediately. 3. Lifestyle choices. Limit alcohol consumption, as alcohol can significantly strain and damage the liver, particularly when combined with certain medications. Maintain a healthy weight. Obesity can lead to fatty liver disease, which exacerbates the risk of liver damage from medications. 4. Diet and exercise. Eat a balanced diet rich in fruits, vegetables, lean proteins, and whole grains to support overall liver health. Regular physical activity helps in maintaining a healthy weight and reduces the risk of fatty liver disease. 5. Avoid toxins. Minimize exposure to environmental toxins like aerosols, chemicals, and smoke, as they can burden your liver. Be cautious with the use of herbal supplements as some can be harmful to the liver. Always consult your doctor before starting any new supplement. 6. Consultation and communication. If you experience any side effects from your medications, discuss them with your healthcare provider. Regularly consult with your healthcare provider to evaluate the necessity of continued medication and explore possible alternatives if there are concerns about liver health. 7. Stay hydrated. Drinking enough water helps the liver to flush out toxins more effectively. 8. Vaccinations. Get vaccinated against hepatitis A and B, as these infections can severely affect liver health. By incorporating these practices into your daily routine, you can significantly contribute to protecting and maintaining your liver health, even while on medication. Remember, your liver is a vital organ that plays a key role in your overall health, and taking care of it is essential. If you have any concerns about your medications and their impact on your liver, or if you're experiencing any symptoms of liver distress, please consult with healthcare professionals. They can provide personalized advice tailored to your specific health needs. Thank you for watching our video. If you found this information helpful, please give us a like, subscribe to our channel for more health insights, and don't hesitate to share your thoughts and questions in the comments section below. Stay informed, stay healthy, and take good care of your liver.